No mai, hoki mai. I trust you all had a great break and a chance to leave your space. We're now going to step into shift 5 towards safe, accessible, integrated responses. We're going to hear a series of lightning talks. I had to look up what lightning talks were. Actually, I didn't know whether this was happening outdoors, but lightning talks just means they're going to be very quick from contributors such as Dr Christine Foley, Kathryn McPhillips, and Anthony Tebbutt on National Tripartite Forum. Then we'll focus on safeguarding disabled adults from Delia McKenna and Sue Hobbs. For this session, it's also my great pleasure to invite Dr. Ashley Bloomfield, Director General of Health, and Andrew Kibblewhite, Chief Executive of the Ministry of Justice, as they both listen in along with us. Andrew Kibblewhite will offer some of his closing thoughts at the end of this session. I'll now hand it over to the Tripartite Forum. Kia ora.
Kia ora. I'm Kathryn McPhillips from HELP in Auckland, and I'm here with my colleagues today to talk with you about the initial tripartite response to the sexual violence against adults and how we try to make this part of the process safe, accessible, and integrated. This response has been available for decades in some parts of the country, but is a more recent development in others, made possible by increased investment by MSD, police, and others, so we now have a national response. So adults are able to access this tripartite response, and in some areas, young people as well. It's a connected response between police, specialist medical services, and specialist crisis support services, including kaupapa Māori services where these are available. This is currently in quite limited areas across the country, but we do look forward to more services being available over the next few years. So this joined up response means that you can contact any of the three groups, so contact crisis support services, medical support, or police, and also access any of the other two services through them if you want to. So you might think we're an unlikely bunch to hang out together, but we do meet regularly. We have contracted agreements in place in each police district, and we also have a national forum which supports the local relationships and gives us a place to work through issues and developments which can assist us all to support survivors better. So the part I represent is crisis support services. So what can you expect from us? So our role is to attend to the survivor's mental health and emotional well-being. So many people are traumatised from sexual assault. It can feel like walking around with no skin on your nervous system. So anything unfamiliar or uncomfortable can exacerbate that trauma and the feelings of shame and self-blame which often come with it. So 24/7, we go with people through police and medical processes so they're not alone, to help them understand and navigate the system so they can make the best decisions for themselves. We will advocate for people if need be and make sure that they have somewhere safe to go. We will assist them with managing whatever symptoms or worries they have related to the assault. We're also there for the long haul. People can call us back anytime. They can come and see us for counselling or social work support and have us with them through the rest of the criminal justice process. Many services can also see people for longer term counselling or other needs. Handing over to my police partner.
Kia ora, my name is Anthony Tebbutt and I'm a Detective Senior Sergeant with the New Zealand Police. So in regards to New Zealand Police, the country is split into 12 police districts and all districts have dedicated adult sexual assault squads and trained detectives that deal with adult sexual assault investigations. My current role is the National Coordinator for Adult Sexual Assault and I'm part of the sexual violence team based at Police National Headquarters. Our team has national oversight of adult sexual assault and child protection, and our role at headquarters is to provide policy, training and guidance to the districts with the aim of ensuring national consistency. For police, the priority is always the safety and well-being of the survivor. Of secondary importance is the investigation and the collection of forensic evidence. We work closely with our specialist crisis support services and MedSAC doctors and nurses, and we will always look to engage with them early in the investigation process. Reporting to the police does not necessarily mean that the matter must go down the prosecution route. Police will always talk through the different reporting options with the survivor and take their views into consideration. Survivors will always have input into the police investigation and be consulted throughout the process. If the survivor is not happy with the outcome of their investigation, they can request a review of the investigation through our team at Police National Headquarters. We also have a dedicated adult sexual assault webpage on the Police National website where survivors can learn about consent, watch videos on the reporting process and get information on keeping safe. Survivors can also provide feedback to our team at Police National Headquarters on the investigation process through an online survey. The survey can be completed anonymously or survivors can choose to leave contact details. Our team will follow up with any feedback where there are complaints or concerns raised. Please remember that it is never too late to report a sexual assault. I'll now hand you over to my colleague, Chris.
Myself, right. Kia ora koutou. My name is Christine Foley and I'm a doctor working in a sexual abuse assessment and treatment service called SARTS, and I work in the Tāhū clinic in Auckland. I'm also involved in MedSAC, which is Medical Sexual Assault Clinicians Aotearoa. SARTS is the name for the medical and forensic service providers staffed by doctors and nurses, and MedSAC is the organisation behind this, which provides the education, accreditation and support for both the clinicians and the services. Firstly, I want to just underline what Kathryn has said, that all medical services operate under the tripartite model, which ensures that no matter which door the person knocks on, that they will be provided with access to all aspects of care: health, crisis support, forensics and police. The SART services provide both therapeutic and forensic medico-legal care, and it's important to know that the therapeutic care, which is the health and emotional support, always takes precedence. We take referrals from all sources, and all SATs operate under this local level agreement with their local crisis support and specialist police sexual assault teams. If a referral is from the police, the above all still applies. The SARTS process and crisis support involvement with us ensures that a decision to continue with the police process is a fully informed one. This means that the person can press the pause button at any stage. Above all, the person is in control, and SARTS aim to provide them with all the support they need to make the best decisions, working in partnership with our co-providers. That is the core of the tripartite model of care. So I'll hand it back to Kathryn.
So just lastly, we're saying that, we're easy access. So the way to access services. So to access a medical service first, SARTS, SAATS, check their website. Police, if it's acute, call 111 or check the website for other phone numbers. And for crisis support services, check the Tor Nest website to find your local service. You can ring any service to be put in contact with any other service as well. Thank you.
Christine, Kathryn, Anthony, thank you very much for your contributions there. We'll now focus on safeguarding disabled adults. Over to you, Sue and Delia.
Tēnā koutou katoa, ko Sue Hobbs, tōku ingoa. Thank you for this opportunity to talk about the safeguarding mahi in the Waitemata. With me today is Delia McKenna, the Safeguarding Adults from Abuse League. If you were fortunate enough to hear my colleague Paul Brown speak yesterday, you would have heard him say loud and clear that disabled people are not in the waka, that we, and I quote, have been ignored and underserved for too long, and we won't be ignored anymore. Tāngata whaikaha Māori, deaf and disabled people advise that recognising and responding and resourcing an inclusive approach that meets the needs of all New Zealanders can only occur when there is recognition and acknowledgement of the marginalisation and exclusion of disabled people in the current family violence and sexual violence system, and when we have the power to lead solutions that meet our needs and aspirations. The project in the Waitemata has been developed as a result of what we've heard from the disability community. Disabled people want a disability-led, human rights-based, twin-track approach to prevent and respond to violence. The project is just one of the initiatives that's happening towards Action 28 in particular, and will inform other actions such as 29 and 30 in the action plan. We aim to improve access, create equity and inclusion, and improve quality of services to enable Tāngata and whānau whakaaro Māori, deaf, disabled people, adults at risk and families impacted by family violence, sexual violence and any form of abuse and neglect to access services and support through either mainstream, specialist services or both when they need help. Towards our aim, we are working initially with 6 settings in the Waitemata to start to implement the safeguarding framework, which I'll explain in just a moment, and to grow and strengthen the existing Safeguarding Adults from Abuse, SAFA for short, multi-agency response. This is to meet our responsibilities under the Crimes Act 1961 in safeguarding vulnerable adults and address the gap in the current system for adults at risk between 18 years and 64 years. We are working with the police, Family Action, Help Auckland, Te Whatu Ora, Spectrum Foundation and Taikura Trust. And I just want to pause for a moment just to thank all those people within those organisations for their commitment and ongoing support. To get a different outcome, we need a different start point and a different approach. Together, we are co-developing the Tiriti rights-based twin-track response to making services accessible and responsive to Tāngata and whānau whakaaro Māori, deaf, disabled people, adults at risk and families. So just what is safeguarding? We know safeguarding, it's broader than child and adult protection. It relates to the actions taken to enable a disabled person to live the life they want, free from violence and abuse and harm. A safeguarding framework has been designed and underpins the Enabling Good Lives approach. We are working together with Tāngata and whānau whakaaro Māori to redesign and further develop the framework to ensure that Tāngata and whānau whakaaro are resourced to be active leaders in this work and have the capacity to identify what safeguarding means for Māori and what a rights-based, twin-track and treaty-based approach is for their communities. So just before I hand over to Delia, I'll just talk a little bit about the Enabling Good Lives. So for those of you that don't know, Enabling Good Lives is a new approach to supporting disabled people that offers greater choice and control over the supports people receive so people can plan for the lives that they want. The framework provides a range of activities and responses that protect and promote people's rights, their culture, safety and well-being. It also fosters an integrated community-led way of working to enable people to live the life that they want, free from harm, violence and abuse. I'm just going to hand over to Delia. Bear with us, I'm a bit technically challenged, so one moment.
Kia ora koutou katoa. The New Zealand Crimes Act 1961 defines a vulnerable adult. The term is contentious. No one is inherently vulnerable. So we use the term adult at risk as the preferred term. An adult at risk is an adult who has needs for care and support, who is experiencing or is at risk of any form of violence or harm, and because of their need for care and support, they're unable to protect themselves from the violence or the risk of it. Anyone who has need for care and support who cannot protect themselves can become an adult at risk. In other words, an adult at risk can be a disabled person, but can also be an older adult, a person who's very ill, or who has a temporary physical impairment, a person experiencing mental distress, a woman impaired by violence. SAFA has been in operation since 2016 in the Waitemata. It comes from the community need. SAFA is a multi-agency response to prevent and respond in situations of violence and abuse of adults at risk, while supporting the person and the whānau to remain in control of decision-making about their supports and maintain control in their lives. It is also about people, organisations and communities working together to prevent and respond to violence. SAFA provides a strength-based, person-led and whānau-focused, human rights-based approach. Finally, the project is being evaluated by Synergia. The evaluation takes a kaupapa Māori approach. The findings will provide critical evidence to inform actions 28, 29 and 30 and inform the ICR work programme and will help in guiding how we work together to achieve change. That is a significant shift to a system that provides equitable access for everyone and offers tangata whaikaha, deaf, disabled people and adults at risk choice of either mainstream, specialist services or both through equitable funding of a twin track approach with no wrong door. Kia ora koutou.
Now, Andrew, we'll cut over to you to help close this session, and then we'll acknowledge our speakers.
Kia ora koutou, and thank you for the opportunity to be here. I'm Andrew Kibblewhite. I'm the Secretary for Justice. I also have the honour of effectively being I've been the Deputy Chair of the Chief Executive's joint venture. I acknowledge Ashley here beside me as well, and Ashley will offer some comments as well. Ashley, this is your last day in your current role, where you have become such a part of all of our lives over the last couple of years. So I will try and keep my remarks relatively short, because I think there will be more interest from almost everybody who's on this webinar in hearing from Ashley rather than in hearing from me, excuse me. First, let me acknowledge the kaupapa that everybody is here for, acknowledge how important this is, acknowledge the progress that I think has been made and the leadership that Minister Davidson, that the other ministers who were on the panel just before, that people like Emma Powell have brought to this, and particularly to all of those of you who are out there actually doing the mahi in the community. The thing that I think is most different, well, there are several things different about this effort that we're making to deal with family violence and sexual violence, but the single biggest change, I think, is the understanding and willingness of the government system to recognise and draw on the strengths of the community to actually make a difference. I think that is probably one of the most fundamental things that is different. I would note that as a group of chief executives and as supporting a group of ministers, it's often actually been really hard. We've got well entrenched behaviours that go back a long way that have us doing things separately. The importance of Te Aorerekura, the importance of the way that we're working together now as a quite formal joint venture has meant that we've got different ways of holding each other to account, as well as in engaging with the community. This is about Shift 5, which is about response. So I'll make a couple of quick remarks there. There are a legion of stories about how we get response wrong. There are many examples of how the system makes people's situation worse. It re-traumatizes them. We are often not nearly good enough at recognizing the diverse and different needs. The conversations about the needs of disability, different ethnic communities, has not been something that the system has well recognized and well responded to over time. So I really acknowledge the efforts of SAFA and the tripartite group that spoke to us earlier, because I think what you demonstrated in your kōrero then was a recognition of how we need to work much more effectively together, recognising the individual and specific needs of people. The other thing that we often get wrong in response is that we respond in very siloed and different ways. You would have heard Minister Allen talking on the ministerial panel about the way the work being done in relation to victims. Some of the things we're having to pick up there is the fact that at the moment the information is held in different places, the relationships are passed on from one agency to another as a victim works through the response system, and that probably more often than not, as we pass information or the relationship along, we lose things. We require people to repeat some of what their experience is. The data gets put in the wrong place, and the whole system, we know from the feedback we get, ends up being really unsatisfactory for people. So that's part of what we're working on now. We've been very committed as a group of chief executives, both across the broader joint venture, but particularly in the justice sector, when you're talking police, courts, which is justice, corrections, all of these agencies have an interaction with victims, and we're looking to bring that forward. The only other thing I would note, because again, I think it's part of the response being what do police do, what are the NGOs that wrap around victims do, what happens in the courts, is to reiterate some of the points made again by the ministers in the Te Ao Marama space. I think there is a journey there that we're embarking on, as noted by ministers, judicially led, to actually bring a different experience to the court, where people can be much less isolated, much less alienated in that process as they move it forward. Now, I'm going to stop there. I'm going to hand over to my colleague, Ashley. I think it's a rare honour to be sharing a screen with you on this day in particular. And as I pass to you, can I just say thank you as a fellow CE for all that you've done as a colleague and in your leadership in this space.
Well, thank you very much, Andrew. Really appreciate your kind words and the introduction. Kia ora koutou katoa. Tēnā koe, Minister. Nice to see you still on the hui, and it's lovely to be able to participate in this session. Andrew, I think you've made some really apposite comments, and perhaps I can build on some of those. I'd written some notes down, and it's interesting the overlap that we've got, even though we weren't in cahoots. So I wanted to just sort of reflect on this theme of equity that's come through from the way I've heard the panel and the speakers this morning, and three observations to make that I think were issues that were really to the fore or highlighted through the pandemic, and they're absolutely germane to the session we're having now and the presentations we've heard. The first is about trust. One of the fundamental drivers of our success in our response to the pandemic was building trust, public trust in the response, and then of course a huge effort to build public trust in the vaccination program. And of course that's not a one-size-fits-all approach. It needed a whole range of approaches to ensure we were accessing different age group, different communities, different ethnicity, ethnic groups and so on, with the right people and the right message to build that trust. And I think that's really relevant to engaging people in the services that are able to be provided to support them. And first and foremost, as was mentioned in the tripartite forum session, that the therapeutic care takes precedence. But we've got to make sure that people trust, first, that that's the case, and secondly, they trust those providing the services. So it's a really important feature of the way these services are provided, and I could sense through the presenters that we had that that's a big focus for how these services are delivered, ensuring that those people who need to access them at a time of great stress and concern and anxiety, and that they do trust the service that they're accessing. So trust is fundamental. The second is, and this was highlighted by Sue and Delia, the importance of making sure the services and that our overall approach to family violence and sexual violence is considering all communities, in particular marginalised and vulnerable people. And we saw this through the pandemic that, to be expected, but the virus sought out quite quickly, and it was like a magnet to those communities where people who were most marginalised and who are the most vulnerable are the most susceptible. And we saw, in particular, in the outbreak in Auckland and Waikato in August last year, that it wasn't just our Māori and Pacifica communities, but people who are homeless people in very perilous housing and accommodation circumstances, people with mental health and addiction issues, was where the virus ended up in those communities. And so, a salutary reminder from Sue and Delia that we need to be particular and proactive in ensuring that the whole approach, from prevention right through to accessing services, is built up with, is designed with, and is implemented with disabled people, and in particular tangata whaikaha. So, if you overlay Māori ethnicity on top of disability, that's one of potentially our most vulnerable and marginalised communities. So real efforts needed to get in there. And again, the pandemic was a reminder to us of the importance of doing that. And people ask me, I'm asked quite often at the moment, what's the most important thing we can do to plan for the next pandemic? And my response is actually address inequities. It's not about detailed planning for this virus or that virus. It's actually about addressing inequities right across society. And my third observation, and again, this builds on something that the point that you made, Andrew, about the difference this time is really, and I've been around the public service for 25 years and been involved at previous times in the efforts to prevent and address family violence, sexual violence, but build on the strength of communities. And again, this was something that really came through to me during the pandemic, was we underestimate the capacity and capability and resourcefulness of communities. And when we do our job right, which is to ensure they have the information and the resources and the support to do what they know how to do, then the results are quite remarkable. And we saw this time and time again through both the pandemic response and through the vaccination program. So again, a salutary reminder and an important time to remind ourselves that if we put those communities in the centre and think about what can we do to tap into that resourcefulness, that capability and that capacity, then we will make a difference. So there are just a few reflections, trying to make the tie between what I've learned in a sense over the last 2.5 years, but also hopefully something that is really relevant to this mahi, this kaupapa. And finally from me, thank you so much to the presenters and also to all of you on the hui today who are involved in this really important work. And it's something that we've got a shared aspiration to ensure that this country does a lot better than we have, and to achieve better outcomes and more equitable outcomes. Kia ora.
Kia ora. Well, if you have been listening over this last session, I think we just need to acknowledge a lot of the people that have contributed to it. Thank you, Andrew Kibblewhite, for your time, and especially to Dr. Ashley Bloomfield. We understand, we did hear that it was your last week in your role as Director General Health, and I can honestly say that I've learned a lot from your leadership, as many of us here, your resilience and your humility as well, as you've conducted yourself in that role. I know your family will be looking forward to having you back at home, and so to them and to you, we say thank you so much. Thank you very much.